everybody, and welcome back to Valley Life. I'm Rich Krebs, and I always have a good time when I come into the Pacific Medical Center of Hope because I get to talk to Dr. Nezami and really pick his brain about what's really happening in forms of alternative medicine, cutting-edge technology. And today I wanted to bombard him a little bit and kind of broach the subject of cancer. Doc, how you doing?
Good, Rich. Thank you for coming.
Well, pleasure to see you. And I really wanted to pick your brain a little bit more because you're just on the cutting edge of new technologies, new theories, things that are giving you tremendous success in the realm of treating cancer. So kind of talk to me about some of what's happening now on that front and how you're attacking it from a different angle.
Sure. It's a pleasure to have you here. As a matter of fact, the problem with the conventional treatments of most of the chronic conditions, and cancer being one of them, is that they try to treat the cancer or the chronic condition without paying attention to the whole body. And so what we have found is that if we boost the immune system and we target the cancer by increasing the defense mechanisms in the body will start to fight with the cancer at the same time. What we offer here absolutely is not against any conventional treatments. Okay. But what we clearly have found very good success with the cutting-edge treatments that are mostly natural-based. And as I said, they increase the immune system in the body, and they have tremendous results in our patients. And we have patients who have stage 4 advanced cancers who travel all the way from across the country and even from Europe to come here and get the treatments. In the past 2 years, I've been very successful treating these patients with very advanced cancer. And in different stages, we've got tremendous results. We're publishing these results actually recently to the National Cancer Institute and NIH as base case series. So I'm happy to share this information with the patients and the public.
Right now, what put you on this path to kind of go a different route and attack it from a different front than what most people are doing?
You know, it's a very interesting question. You know, when I used to be trained in conventional treatments, conventional medicine, we had no answer to many of the advanced cancers. At that time, when the patient was diagnosed with a recurrence of the cancer, and most of the chemotherapies did not work and did not show improved survival for the patient, we had to just say bye to the patient and close all the doors of hope. So at that time, I was challenged by all these cases that we really didn't have any answers and there was no hope for them. So when I started to be trained in integrative oncology, I found many of the scientists in this field that they had very good success, but there were only a few of them available. Okay. So I did all the trainings and I started to treat these patients in conjunction with their oncologist. And we found tremendous results in unbelievable fashion that, as I said, it's extraordinary. It has never been seen in the history of treating cancer.
Sure. And your background, it's not that you went and just happened to find some degree at a subpar school or anything. Your background's at USC. And then all the other certificates sitting on your wall is just that much more education and knowledge that you've acquired over time to attack this approach. I mean, so this is coming from one of the best schools in the world.
Exactly. What we do is completely science-based. It's backed up by many articles that have been published, and it's been published in the journals in clinical oncology. It has been validated. We do research practice too. We do research treatments too, and we're interested in participating in clinical trials and cooperating with the oncologists. But as I said, these treatments are all science-based, and that's why it works.
Sure. Now, what we're looking at back behind you right now, we've got a patient in the bariatric chamber, which is the pressurized oxygen delivery system, which is, again, giving the body something more of what it needs to defend itself.
Right. The cancer usually grows when there is no oxygen in the environment, and that's why hyperbaric oxygen plays a big role as part of conjunctive treatment that we have here. We also provide IV therapies that, as far as I know, we're the only center probably in the whole United States that has all the clinical modalities of treating cancer at one place. And as I said, we collaborate very closely with the oncologists in town, and we have been very successful, as I said, to the point that the oncologists in town are referring patients to us.
Perfect. Now, I just said bariatric and hyperbaric. They're two completely different things.
Hyperbaric oxygen basically forces the oxygen into the cancer tissue, and that's why it reverses the pathology, so the cancer cell cannot survive in an environment that there is oxygen. Also, what it does is that it potentiates the effects of radiation and chemotherapy. So, for example, if a patient is getting those treatments and on top of it, he or she does hyperbaric oxygen, those treatments are more effective and with less side effects.
Don't go anywhere. More Valley Life coming up right after this.